Hi, in this video I'll be talking about preparing for and experiencing your first chemotherapy treatment. I'll talk about what to bring, what to expect, how you can keep yourself busy, and some other tips for getting through that first day. So what to bring to your first appointment? The most important thing is to bring somebody who loves you. This doesn't have to be your partner. It can be a friend, your mother, a sister, somebody from church. It's just nice to have somebody to process the day with. And also, it's really disorienting for you. It's the first time you've been there. You don't know what to expect. It's nice to have a second set of ears and somebody just to help pass the time. Chemotherapy appointments can take anywhere from 20 minutes on the very, very short end up to 8 hours. And you can imagine if you're there for 8 hours, it's nice to have somebody with you. What else to bring besides a person? Well, bring some snacks. Bring some crunchy, mild snacks, not hard crunchy like Doritos, like we talked in our best diet video, but bring something that like nuts or something that's got a little bit of a bite to it that can help when you're anxious. It can also feel really good to be able to bite into something. So baby carrots might be something to bring. You might find chewing is also really helpful. Hard candies are good if you have a dry mouth, especially if you bring lemon flavored things. Those can be really helpful because they can help produce more saliva. You might be finding yourself licking your lips, so bring a lip balm that can help your lips from drying out. The other thing that you might want to know ahead of time is how to dress. Chemotherapy infusion centers, like any place in the hospital, can be warm or can be extra chilly. And you may also find with the medications that you get that you have experiences of chilliness in your body with IV fluids, for example. Those can make you feel cold. Or the corticosteroids we give to prevent reactions to chemotherapy can make you feel warm. So we recommend that you wear really comfortable clothes, but that you layer a little bit so that you're not particularly cold, or if you get warm, you can take off a layer. You may want to bring a lightweight blanket just for something to keep you warm. Most infusion centers will have blankets, both room temperature and warm blankets. So if it's a lot to worry about, don't worry about bringing a blanket. You'll most likely be just fine. Back to what else you might want to think about when you're getting dressed. If you have a port, which is a semi-permanent IV under the skin, you'll want to be wearing clothes so that your nurse or pharmacist can actually get to the port. So that's just one other thing to keep in mind. A high turtleneck with long sleeves could be a little tricky. We do not expect you to change into a hospital gown, which is a really good thing for most people. Otherwise, wear loose clothing and comfortable shoes. If you wear open-toed shoes, I'd recommend you also bring some socks because your feet might get chilly again with the IV fluids, or just if the ambient temperature is cool. What about things to do? There's not a lot of space in an infusion center, so you can bring one person, but not two in general. They can take turns if you have two people with you that day. And don't expect to be able to spread out a lot. You'll get one of those tray tables most often that's, the size of maybe a small lap desk, or a little bigger than that. It's usually adjustable in height. But you might want to bring cards, board game, bring your iPad if you have one, or another device like an e-reader, something to help pass the time. Even your phone with headphones can help if you listen to books on audio or music. That can be really relaxing for people. Some people find that they just want a cocoon, so they put their headphones on and they just want to be left alone. Maybe if you bring a friend, they can be there also being kind of quiet. And other people like to socialize with other people in the infusion center. You like to develop a community of people that you see maybe every cycle that you come in. Let your nurse know whether you'd like to be on your own, in which case you might be able to be in a quite private space, or if you want to be out with other people. It really helps to bond. I've had times where I've gone back to see a patient who had a question, and all my patients from that morning are chatting with each other and supporting each other and cheering each other on. That just may not be your style. So let your team know when you get to the infusion center itself what you would prefer. You can bring small puzzles, but again, you're going to want to be able to pack up and go pretty quickly when you're done with your treatment. You don't want to have to take an extra trip to the car, so some people bring in a little roller bag or a backpack, something like that. The person who comes with you, if you have somebody that you choose to have come along, they can help carry your stuff. But really, you want to travel kind of lightweight. You will learn with different, with your next session and the one after that, what's most helpful to you, so you don't have to get it just right the first time, but some of these tips could be really helpful for you. Other things to be prepared for, you may find that you're anxious. It's a new experience, and no matter how well you prepare intellectually, your body and your emotions are going to be, thrown for a loop a little bit. It's the first time you've done it. If you are particularly anxious and you're not driving yourself, your nurse can get a prescription from your physician to give you something that will help you relax. Sometimes those very things can also help with nausea. Things are going to come up when you're at the appointment. You may have a reaction. Just know you're in the best place and in the best hands. And if you get through your first treatment without any events, it's still possible you could have a reaction the second time, but it's less likely. You may want to bring a journal to write down questions for your medical team. Your nurse will be sharing herself with a few other patients, but when the infusion's going in, you will have your nurse by your side. And usually the physician is on site. It might not be your doctor, but it'll be somebody else in the practice who can come should any problems arise. I've covered a lot in this video. I've covered who to bring, what to expect, a little bit about what you might bring to snack on. You'll want to also bring something to drink, which I didn't mention before, but you will also be provided usually with snacks and beverages while you're there. I hope this has been helpful to you. Don't forget to visit Yerbba.com to learn more about what you might expect as part of your treatment plan. And if this video has been helpful, click like and subscribe. What that does is it helps YouTube help other people going through this find this video. And if you have a comment, drop it below. We try to answer those within a couple weeks at the latest.